AM 1300, the Talk to Me station. We're here with you every Saturday from 11 to noon. And today we're bringing you valuable information about a subject we touched on last week, and that's traumatic brain injury.
We did. We just scratched the surface and the amount of response. I mean, Facebook blew up with instant messages or whatever it's called on there, and emails and phone calls. So obviously, Glenn, we did a little digging, got a little more of our information, because this is a very technical issue, yes?
Oh, absolutely.
And we'll have an expert guest on to illuminate on this, but we thought it was our duty here at American Warrior Radio, since so many people are clamoring for more information about this disorder, that we kind of give a thumbnail sketch about what it's all about.
Yeah, and TBI, as we mentioned before, happens, traumatic brain injury happens when something outside the body hits the head with significant force. This can happen when the head hits a windshield or in a car accident. It could happen when a piece of shrapnel enters the brain, or it could happen during an explosion, and we talked about that a little bit last week, of an improvised explosive device or any other kind of an explosion, which can be hand grenades and mortar rounds and all of those bad things that you encounter in a wartime environment. But it's something that shakes around that valuable little brain that runs everything in our body inside that hard shell skull that holds it and tries to protect it, but in this case it's reverse protection because it rattles around in there and gets injured.
Yeah, bouncing from side to side. I think I kind of said, think of an egg and the yolk inside the egg shell. You can juggle that egg around. That yolk is not staying in the center.
That's right.
You know, the albumin, here we go, all scientific, is what's keeping that yolk safe, kind of like probably the cerebrospinal fluid around our brain,
yeah.
But it still is not wholly effective, and our brain will crash against one side of the skull and then back and forth and back and forth. And predominantly from the concussive blasts when we're talking about combat exposure, right, Glenn?
Yeah, and maybe the windshield example for wrecks that they experience.
Of course.
Particularly since the most folks are in Afghanistan now, and that's a very mountainous country, and if you run off the road there, it doesn't do good things for the vehicle you're riding in.
Exactly, and TBI has been around a long time, and a lot of you listeners out there have probably heard all the noises being made about the NFL and the players that wear their helmets, and you know, they run into each other at high speed, you know, 300-pounders all the time. You're going to hurt your bean. You're going to hurt your brain.
Exactly.
And motorcycle riders, even though here in the Florida you have the right to not have to wear a helmet, I would encourage everybody to, because you only get one brain and it gets damaged a little easier than most people think. But the weaponry that we've given them and the solutions that they have on the battlefield, and we discussed this, those MRAPs and other devices and ways to up-armor these vehicles, doesn't really stop the blast, the concussive blast.
Yes, the concussion effect from the blast that actually is the culprit in most of these cases, causing traumatic brain injury, because that's still going to rattle your brain around inside the skull, and there's where the injuries come from, traumatic brain injury. Less shrapnel entering the brain than it is the it's the concussion blast, or even the concussive force of hitting a windshield in a car wreck.
Sure, and I will give you another example here. If you've been around guns at all, and whether it's a high-powered rifle or a handgun, you know, even a little .32 caliber, it'll give you some serious ringing in the ears if you don't have ear protection. Well, imagine that. All of a sudden you hear a big pow. Okay, now the brain, your ear experiences it one way. Well, the brain in these concussive blasts, the brain's not so concerned with the sound it makes, but certainly the blast itself. And the way that it affects your brain is it really weighs on their concentration, their ability, whoever gets affected by it. It alters their senses of hearing and even vision and smell, taste and touch. Sometimes they have difficulty speaking.
Exactly. So,
and emotional, behavioral changes. And how do they exactly rate the varying levels of the TBI, though? Because I know that there's different grades. They rate it based on mild, moderate, or severe or persistent symptoms. And some folks that experience a TBI, traumatic brain injury, are affected much more profoundly than others, but you got to figure it's safe to say if you had a shell explode, 20 meters from you, you are going to be subject to a TBI.
Yeah, and the other thing to remember is sometimes these effects don't happen, the negative effects from the problem, from the injury inside your skull to your brain may not show up for weeks or months afterwards. You may suddenly start experiencing some symptoms that maybe we'll cover on a high side pass here that are bothering you, and it's up to you to make sure you tell the medical provider that you have that you were involved in some kind of a situation where you got injury to your head. A lot of people, they man up is the word, and don't say anything.
The resiliency training.
Yeah.
Be resilient. In other words, just brush yourself off, pull your boots up, and go back out there. The bottom line is that not everybody's going to experience the same thing, and that a lot of folks, especially, we're talking about battlefield vets, folks. We're talking about the guys and gals that are listening to us on American Warrior Radio right over there in Afghanistan right now, and we know you're there because you communicate with us. To everybody else across the country and the world, if you have experienced a TBI, the majority of folks, the symptoms will fade as time goes by, all right? And by symptoms, again, we're just touching the surface about what are some of the physical symptoms, Glenn? What are some of the physical symptoms?
Okay, your skull could be fractured, fever, difficulty eating and speaking, degraded vision problems, fatigue, loss of hearing, and a loss of a sense of touch. That's all of that compared to what you normally have. So, those are just some of the physical effects.
And, the behavioral and the cognitive effects, in other words, how we actually engage our environment and other people, are a little more complicated, and they can involve difficulty in remembering things, making decisions, solving problems, and as simple as performing day-to-day functions like, taking a bath or dressing or driving a car. Those are important little telltale signs that if you have a loved one, even if they're Skyping you from the front lines in Afghanistan and you notice they're a little off, you might want to throw a question out there as to, did anything happen over the last week since we last Skyped or talked? And they may come back and surprise you with their answer.
Yeah, exactly, and particularly for those that are still serving in a combat zone, because those tend to be the people who are most likely not wanting to go see a doctor for any problem they have because they think they're letting their buddies down.
That's one reason. What would be another one, though? I mean, if they say are having trouble concentrating, they're not going to go see a medic or probably even a corpsman for fear of being labeled something, right?
Yeah, well, for fear of being labeled, I can't think of the word, but
well, a malingerer, somebody that might go,
yeah,
somebody might go to sick call too often,
or trying to get out of the fight, those kind of things.
Right. So they're gonna, as you said, Glenn, man up and just power through. But if you're a battle buddy and you're listening over there in Afghanistan right now, and you notice your battle buddy having difficulty with the things Glenn was talking about, those are visible physical effects. But some of the behavioral effects that can manifest after a TBI, Glenn, give me a couple of those.
Well, anxiety, being agitated or frustrated, sudden impulsiveness, depression, regression, return to childlike behavior, and many others. So those are
if they're acting out of the norm.
Well, absolutely, and you know this person or your battle buddy, you'll know if they're acting out of the norm. So,
and that applies to everybody back here at home also. When your loved one comes back from combat or wherever they were, if they had an awful accident, they could be, like I said, just doing some overseas duty somewhere and had a Jeep accident or something and banged their head, and they didn't so much as tell anybody because right after the accident, they felt okay.
Yeah, exactly. Well, they probably might feel okay because they're numb.
Right. So you want to keep an eye on it, and that's why the VA has such difficulty, and we'll touch on a few of those things. Right now, we're just talking specifically about what the disease or the injury is and how the VA is viewing it from a healthcare standpoint.
Exactly.
Because that's entirely different than the benefit side of the house.
Oh, yeah. And yeah, we're talking the medical side, the clinical side right now. The benefit side, while related to the clinical side provides the evidence to support the claim side of the house. They're not always that interconnected.
That's right. So you just listen right up to Dr. Glenn and Dr. Guerin here.
Yeah.
Not. But we're still trying to, like Glenn said, give you a high side pass to familiarize you with what some of the signs and symptoms are, whether it's a loved one, whether it's yourself, if you can identify these things in yourself. Cognitive. Give me some of those examples of a cognitive effect of having a TBI.
Well, the lack of attention and concentration or memory loss, lack of judgment and communication type problems.
So if a warrior, let's say, knew they experienced a TBI, and they don't know what to call it or anything, but weeks later or maybe even 2 months later when they come back stateside, they realize they're having trouble concentrating, whether it's sitting down to read a manual or study for their next exam or grade. I mean, that would be a telltale sign that something may be off.
Yeah, I think that's probably one of the bigger areas that people would notice is that the lack of being able to concentrate. Just, you can't focus on things.
And it kind of dovetails into lack of sleep and how quickly someone's able to think. So there's some interconnections with the cognitive effects as well as obviously the physical and the behavioral effects. The loss of vision is an interesting one, and it's one that I know the VA, again, healthcare side of the house, is taking very seriously because that can affect a lot of folks that have TBI.
Oh, absolutely. And along with that is a loss of hearing and or sense of touch. That would affect how you can focus and learn things. So, you know, that and how you can learn things, of course, is the root of what cognitive effects are.
And what's going to be really neat when we do have our expert on, and I'm gonna hold back telling you who he's going to be. It is a he, the guy I want to get anyway, because he is an expert, and hopefully we'll get him because I know he'll be able to develop this a lot more than we can. But something as simple as being able to touch something and understand what it is you're touching, okay? Yeah. And whether that's heat or cold or I guess some aspect thereof.
Well, yeah, I mean, even just feeling the texture of what you're touching and so forth.
For your brain to not be able to compute what that is and what it used to be.
Yeah, exactly, and that, you know, that's a neurological, a nerve type problem caused by the traumatic brain injury.
So, folks out there listening in Radio Land to American Warrior Radio, are you starting to get a clue? This is it's the unseen wound of war now.
Yeah, because in most cases you may not see this, but I mean in severe cases there can be swelling of the brain, and they may have to drill a hole literally in your skull to let the pressure release from the swelling of your brain. But in many cases, like Guerin's referring to, you don't see this.
Outward signs.
It manifests itself in these symptoms that we're talking about.
That's why, and that's exactly why we're trying to bring these to light here. Fatigue can make it difficult to move, you know, here and there and everywhere, not just efficiently, but also safely. If you're fatigued because your brain's been injured, you may have difficulty or not know why you're having trouble walking down a straight hallway.
Yeah, exactly. And then finally, some memory loss can make it difficult to communicate with others, and obviously it makes it difficult to remember what's going on. It causes confusion. You sit there and go, now, what was this person's name? Or what did I just read here 10 minutes ago? I mean, all over the place.
Exactly. So that's definitely the signs and symptoms you want to be aware of. And the screening and evaluation portion that the VA goes into is to determine if you served, particularly those that served in combat theaters of Iraq and Afghanistan, if you were involved in a blast or explosion, and I think Glenn's made it perfectly clear, that's the IED, the improvised explosive device. RPG, if you were near a rocket-propelled grenade.
Yep.
Landmines, grenades, and I think you also touched on the vehicle accident or crash.
Right, exactly.
And then there's another one, the fragments. I mean, if you had a fragment,
a shrapnel injury, anything that would be an injury type that you get, it punctures your skull and into the brain. And bear in mind, those things can also happen from vehicle accidents. And bear in mind, we're not only talking, these are not just combat injuries. They happen, it could happen
falling off
in
a truck.
Wyoming, driving on the base on a mail delivery run, and you have a wreck.
So if you think you have a TBI, let's say you're parachuting and you have a hard landing and you crack your head on the ground, it could result in a TBI.
Oh, absolutely.
It's just we finally are putting a label on this so that the VA and the active duty healthcare services can start to address it more effectively. I want to point out that, and again, we're talking specifically about the VA, and we're gonna share some information because, like I said, this is a very involved area we're talking about. A whole lot that you can speak to, but a positive test on what they consider their screening and evaluation does not necessarily mean you have a TBI. It means that you're noticing symptoms that can be related to a TBI or other medical condition. So they're really looking to streamline how they screen for what the, like you said, symptoms are.
Exactly, and once again, we're going to have, hopefully we'll get the guy we're after and have a really great expert on this.
But I want to share, before we go on to some other things we got to talk about regarding TBI, one of the ways that they measure it is the Rancho Los Amigos scale. And it's actually 8 levels, with 8 being the least affected. If they identify you as potentially being a TBI affected soldier, sailor, airman, or marine, level 8 being the least, level 1 being you're messed up.
Yeah, and these are related into the claims business and how severe they rate you.
And we can't really touch on all of them, but I will let you know, if you hear your doctor or physician start speaking about having to put you through a Rancho Los Amigos scale, just understand it's for your own good, and they're trying to, determine how significantly impacted you are by what's happened inside your skull.
Oh, yeah.
But we do need to touch on the PTRP, Polytrauma Transitional Rehabilitation Program. And this is where there are only 5 of these centers in the United States. Where are they located, Glenn?
Well, fortunately, we've got one over in Tampa.
Thank God.
And then in Minneapolis, Palo Alto, California, Richmond, Virginia, and San Antonio, Texas. And I think the VA has future plans to get more of these going, depending on demand for this type of treatment. But the one in Tampa is just simply phenomenal.
It truly is, and we're not going to let the cat out of the bag, but that's the area we'll be pulling our expert from. The VA Polytrauma Transitional Rehabilitation Program, PTRP, they are time limited, okay? They're goal oriented, they're residential rehab centers, and they do phenomenal work in trying to help the warrior adjust to their life with their TBI. There's not necessarily going to be a cure.
Exactly, but they are on the cutting edge of medical science and trying new types of treatment that will help people afflicted with TBI.
So Glenn, let's say I'm a warrior out there in Middle Tennessee right now and I'm listening to American Warrior Radio, or I'm right here on the Space Coast and I want to know how I can get over to see some polytrauma TBI people and get myself diagnosed. Is there a number that I can call?
Yeah, well...
Or have my doctor call?
Either one. Start with admissions and referrals for polytrauma/TBI at 813-972-2000, extension 7614. 813-972-2000, extension 7614.
That's if you think you're suffering from TBI and you want more information, or if your doctor thinks you are, you can share that with him or her. I'd be surprised if they didn't know. But sometimes you need to push them.
Yeah, exactly.
And that's the information you need for that. Very quickly, again, we're running out of time. The VA recognized that there are 5 illnesses related to service-connected TBI. In other words, if somebody's already been declared service-connected, they are, number 1,
Parkinson's disease, certain types of dementia, depression, unprovoked seizures, or certain diseases of the hypothalamus and pituitary glands. I want to make something real clear real quick, and that's that if you have these secondary conditions, the VA will know that through their screening and diagnostic processes, and you do not have to file a claim for these. Don't get confused about that. The VA will go through the claims process and determine if you should be service connected for these in addition to TBI.
I want to throw out there real quick also a couple items. AVET Project needs donations, whether it's $1, $5, $50, or $500. We've got too many things going on that we need help with. You need to help us help them, meaning our warriors. We've got a bunch of guys and gals returning from Afghanistan in the middle of February. So go online, avetproject.org. Hit the secure PayPal button and volunteer also. We need your help. And we never want to go without mentioning this next one, Glenn.
Yeah, the VA crisis line for veterans contemplating suicide, thinking about suicide, or their family members or a concerned friend, 1-800-273-8255, press 1. 1-800-273-8255, press 1.
Folks, join us again next week on American Warrior Radio. We're going to have an exciting guest with us. We're glad you joined us today. We ask you to grab a pencil and paper because of the information we give you. If you want to check any of it out, it's archived at 1300WMEL.com, 1300WMEL.com. And as always, Glenn,
don't forget, thank a vet.